Welcome to our educational video. The information in this video is for nurses who take care of patients with SEEG electrodes in place. What we want to do is provide practical information to improve patient care. First point I want to make is give an overview on SEEG electrodes, kind of a reminder of what it's all about. SEEG electrodes are where multiple electrodes are placed through small burr holes placed in the skull. And oftentimes there's about 10 or 15 electrodes that are placed through the burr hole and deep into the brain. This allows us to monitor for seizure activity both on the surface as well as at the depths and be able to figure out where the seizures are coming from. So it's really cutting edge technology so we can really localize those seizures and give patients the best possible epilepsy surgery. There's your overview on SEEG. Let's talk a little bit about the timeline of what a patient goes through when they're going through the SEEG admission. So I think nurses have mentioned that it'd be helpful to have a good understanding what happens from the beginning to the end. So before the patient arrives, there's been some prep work to make sure the patient knows what the risks and benefits of the procedure are, and also some of the safety rules on the unit. We're trying to do a really good job of preparing patients so they know that they have some restrictions. They have to stay confined to their rooms. Some of the rules about getting out of bed and going into the bathroom. We're trying to make sure that they know what the rules are so patients are well informed before they get into the hospital. On hospital day number 1, when they're admitted early in the morning. They have those SEEG electrodes placed. Usually it's about a 5-hour procedure. Usually the procedure is done in early afternoon. On day 1, they go from the OR to the ICU, and they stay in the ICU overnight. And so on that first day, they get their CT, and first days in the ICU and staying overnight. On hospital day number 2, that's when they come up to H8000, and we start lowering their medications usually, and try to record their seizures. Even when they're in the ICU, remember, they're still being monitored with the EEG. So we're not missing an opportunity to record seizures when they're in the ICU, but usually we start lowering the meds on hospital day number 2. Usually it's about approximately 7 to 9 days to try to record those seizures. And once usually we like to get about 4 to 6 seizures, somewhere in that neighborhood. And once we've gotten enough seizures, then the next step is to have the patient go back to the OR, have those electrodes removed, and usually they go home approximately 1 to 2 days after those electrodes are removed. They do not have their definitive epilepsy surgery during that SEEG admission. The SEEG part is just to localize the seizures. What patients do is they recover as an outpatient for 4 to 6 weeks, and then they come back for their definitive epilepsy surgery. It may be a temporal lobectomy, it may be an RNS. There's a lot of options for patients these days for really effective epilepsy surgery. So that's when they come back for that surgery, usually after 4 to 6 weeks of recovery. So that gives you kind of an overview of what to expect with the SEEG admission. Now, the next thing I'd like to cover is some practical issues in the hospital itself. First and foremost, nurses need to be on the lookout for neurologic decline. I think that's one of the most important things for nurses to be aware of when they're taking care of SEEG patients. So, of course, these patients have those electrodes in their head, and so they're at risk to have infection, at risk to have a stroke, other sorts of bleeds, other reasons to decline, increased intracranial pressure. And nursing staff needs to do what you all do a very good job of, is just taking great care of patients, making sure that you're doing your neuro checks and just doing you're really just being doing a thorough job on watching them neurologically. And so that piece is something I always like to talk to nurses about, but nurses are comfortable with that because that's what you do. You have a lot of experience with patients with craniotomies, devices in their head, other sorts of neurosurgical procedures. So that was one of my points I wanted to make, is how to take care of the patients from the serious neurologic issues that could happen. Another issue to go over is electrical safety issues. A lot of questions on this, and we'll just go through some of the highlights. First of all, when patient visitors or nursing staff or any staff enters the patient room, what you need to do is you need to put your hand on that metal so you can be grounded. So that's kind of the thing you need to do. Just have that be part of your routine. The other question we get a lot of, the other issue that we get a lot of questions about is devices. So patients can use their devices. They can have their iPad, iPhone, other sort of devices, but they can't have them plugged in when they're in their bed and using them. What you do is you actually charge those devices at an outlet that's a designated outlet that's far from the bed, so you don't get artifact or other problems. So in summary, you definitely can use the patients can definitely use their devices. There's just some rules that need to be followed. The other part I'd like to cover is just what to do in a code. Somebody's having a code. Code blue is called, and the team is coming in, and you're the nurse right there at the bedside, and they're asking you, do you need to unplug the patient from the SEEG? And the answer is no. If somebody needs to have a defibrillation, what you do is you just you keep the patient plugged in, and you go about the code in the usual way. I like to mention this because this is something I've been asked about, and it's best to know these things before they happen. You don't want to be trying to think up new things. You want to just be going into action in those critical moments. So those are some of the electrical safety issues. Let's now jump on to ambulation issues, because this is another area that we get a lot of questions about. So patients who are admitted for SEEG, they in general need to be in bed with their 4 rails up. They can get up out of bed and get into a chair. If they're in the chair, they need to have the tab on, so just kind of the tab alarm on when they're in the chair. They also need to be belted in the waist restraint, so they need to be protected from that standpoint. Anytime a patient is getting out of bed, it's a 2-person assist. When they need to use the bathroom, there needs to be staff in there supervising them. We all know when patients have falls and have problems in the hospital, it always seems to be fall right in the hospital. Imagine falling with those electrodes in your head and all the possibilities. So nursing staff needs to be there keeping the patient safe. So those are some of the ambulation issues. One thing also to add, patients tend to be in their room the entire time. They can walk around in their room with assistance, but we don't want them walking out in the hallway because we're concerned we're going to miss seizures, and really critical that we get those seizures with those SEEG electrodes in. All right, so that's the ambulation part. The next part I'd like to go over is just information about who to call. And so there's 2 groups that are involved with the SEEG cases at Abbott. The Minnesota Epilepsy Group of epileptologists, and then Metropolitan Neurosurgery, the neurosurgery group, of course. And so if you're having issues with clusters of seizures or questions about the anti-epileptic drugs, you call the Minnesota Epilepsy Group. If it's a neurosurgical issue, things like decline in function, infection issues, these are things you're going to want to call neurosurgery, because in general they'll make the decision about ordering a CT of the brain or other sort of urgent scans that may need to be done. So just keep that in mind, that there's 2 groups involved, and it's usually pretty clear about who to call. Seizure related, call MEG. If it's neurosurgical related, then call Metropolitan Neurosurgery. So that concludes our video, and hopefully you've gotten some good practical tips on how to take care of patients with SEEG electrodes. Thank you.